Most people on Medicare think they know what it covers: hospital stays, doctor visits, basic medical care. And they are right about those things. But what most people on Medicare do not know is that their coverage extends significantly beyond those basics into areas that could save them hundreds or even thousands of dollars every single year, areas that most people never think to ask about, areas that Medicare covers completely or substantially, that most retirees are currently paying out of pocket when they do not have to. My name is Margaret, and today we are going through 8 things Medicare actually covers that most people on Medicare have no idea about. Not loopholes, not workarounds, legitimate covered benefits that are part of your Medicare coverage right now that you may never have used because nobody told you they existed. If this is your first time here, hit subscribe right now, because this is exactly the kind of information this channel exists to share every single week. Let's get into it. I want to start with a woman named Frances. Frances is 72 years old and lives in Charlotte, North Carolina. She has been on Medicare for 7 years. She is careful about her health. She sees her primary care doctor regularly. She takes her medications. She does what she is supposed to do. But Frances has been paying out of pocket for several health-related services over the past 7 years that Medicare would have covered if she had only known to ask. She paid for a diabetes prevention program on her own. She paid for mental health counseling sessions that she thought were not covered. She skipped getting hearing aids because she assumed Medicare would not help. And she has never once had a comprehensive wellness visit because she did not realize it was available to her at no cost. Frances is not careless. Frances is not uninformed about her general health. Frances simply never received a clear explanation of everything her Medicare coverage actually includes. By the end of this video, Frances and everyone watching will know exactly what they have been missing. Let us go through all 8. The first thing Medicare actually covers that most people do not know about is an annual wellness visit at no cost to you. This is completely different from a regular doctor visit. The annual wellness visit is a preventive service covered 100% by Medicare Part B with no deductible and no copay. During this visit, your doctor develops or updates a personalized prevention plan for you. They review your medical history. They assess your risk factors for disease. They create a list of your current providers and medications. They may also perform cognitive assessments to check for early signs of dementia or cognitive decline. This visit is about your overall health picture and your future health planning. It is not a physical exam in the traditional sense. It does not include hands-on examination of your body the way a typical annual physical does. But it is an incredibly valuable appointment that gives your doctor a comprehensive view of your health trajectory and gives you an opportunity to ask questions and understand your prevention plan. Many people on Medicare have never had this visit because their doctor's office never mentioned it and they assumed it cost money. It does not. Call your doctor's office today and schedule your annual wellness visit. Ask them specifically for the Medicare annual wellness visit and confirm that it will be billed as a preventive service with no cost sharing. The second thing Medicare actually covers that most people do not know about is a comprehensive diabetes prevention program. If you have Medicare and you are at risk for type 2 diabetes but have not yet been diagnosed with it, you may be entitled to a structured diabetes prevention program at no cost. This program includes up to a year of sessions with a trained lifestyle coach, working on healthy eating, physical activity, and weight loss strategies specifically designed to prevent or delay the onset of type 2 diabetes. Type 2 diabetes affects tens of millions of Americans, and its complications, including vision loss, kidney disease, and nerve damage, are among the most costly and debilitating conditions retirees face. Prevention is dramatically cheaper and more effective than treatment. And yet, because this program is relatively new to Medicare, and because it is not part of mainstream medical care in most practices, the vast majority of eligible Medicare beneficiaries have never enrolled. Francis paid for a similar program out of pocket, without knowing Medicare would have covered it. To find out if you qualify and to find a recognized diabetes prevention program in your area, go to the CDC website or ask your primary care doctor. The third thing Medicare actually covers that most people do not know about is mental health services, including therapy and counseling. This is one of the most significant misconceptions about Medicare coverage among older Americans. Many people believe Medicare does not cover mental health services or covers them very minimally. The reality is that Medicare Part B covers outpatient mental health services, including visits with psychiatrists, psychologists, clinical social workers, clinical nurse specialists, and licensed professional counselors. After you meet your Part B deductible, Medicare covers 80% of the approved amount for these services, which means your out-of-pocket cost is 20%. That is identical to how Medicare covers other outpatient medical services. Medicare also covers inpatient mental health care under Part A for hospital stays. And if you have a Medicare Advantage plan, your mental health coverage may be even broader. Depression and anxiety are among the most common and most undertreated conditions in people over 65. The stigma around mental health, combined with the mistaken belief that Medicare would not cover treatment, keeps millions of older Americans from getting help that is covered by insurance they are already paying for. Frances was paying full out-of-pocket rates for counseling sessions for 2 years before someone told her Medicare covered 80%. That is money she can never get back. The fourth thing Medicare actually covers that most people do not know about is smoking cessation counseling. If you use tobacco products, Medicare covers up to 8 face-to-face counseling sessions per year to help you quit. These sessions must be provided by a qualified doctor or other Medicare-recognized health professional. For those who qualify, there is no out-of-pocket cost for these sessions. Smoking is the leading cause of preventable death in the United States, and its effects on the heart, lungs, and circulation are particularly dangerous for older adults. Many people who want to quit have tried multiple times and failed not because of lack of willpower, but because they did not have adequate professional support. This counseling is covered. Ask your doctor about it. The fifth thing Medicare actually covers that most people do not know about is certain preventive screenings that most people think they have to pay for. Medicare covers a long list of preventive screenings at no cost to you, including colorectal cancer screenings, such as colonoscopies, mammograms for breast cancer screening, pap smears and pelvic exams, prostate cancer screenings, bone density tests for osteoporosis, lung cancer screenings for people who meet certain smoking history criteria, abdominal aortic aneurysm screenings for men who have ever smoked, cardiovascular disease, risk screenings, and depression screenings. Many people on Medicare are paying copays for screenings that should be free because the billing was handled incorrectly or because they did not know to ask whether the service was preventive. Before any screening appointment, confirm with your doctor's office that the service will be billed as a preventive screening under Medicare and not as a diagnostic service, which is billed differently and may have cost sharing. This single question before every screening appointment can save you money every single time. The sixth thing Medicare actually covers that most people do not know about is cardiac rehabilitation. If you have experienced certain heart conditions, including a heart attack, coronary artery bypass surgery, stable angina, heart valve repair or replacement, coronary stenting or heart transplant, Medicare covers cardiac rehabilitation programs. These programs are medically supervised and typically include exercise, education about heart-healthy living, and counseling to help you reduce your risk of future heart problems. Medicare covers up to 36 sessions in a standard program and up to 72 sessions in intensive cardiac rehabilitation for people recovering from serious heart events. Cardiac rehabilitation is one of the most evidence-based interventions available. It significantly reduces the risk of future cardiac events and improves quality of life. And yet many Medicare beneficiaries who qualify for it never enroll because they assumed it was not covered or were never referred by their doctor. If you or a family member have experienced any of the qualifying cardiac conditions, ask your cardiologist specifically about Medicare-covered cardiac rehabilitation. The seventh thing Medicare actually covers that most people do not know about is limited dental, vision, and hearing services in some plans. I want to be careful and honest here, because this one has important nuances. Original Medicare, meaning Parts A and B, does not cover routine dental care, routine vision care, or hearing aids. This is one of the most significant and frustrating gaps in Medicare coverage, and it affects millions of retirees. However, there are two things people often do not know. First, Medicare does cover certain dental and vision services that are medically necessary and related to another covered procedure. For example, if you need cataract surgery, Medicare covers the surgery and some related services. If you have a medical condition that requires a dental procedure, Medicare may cover it if the dental work is integral to the medical treatment. Second, most Medicare Advantage plans, which are private insurance plans that replace original Medicare, do include some dental, vision, and hearing coverage. The quality and extent of this coverage varies enormously from plan to plan and from year to year. If you are currently on original Medicare and paying fully out of pocket for dental, vision, and hearing, it is worth reviewing whether a Medicare Advantage plan in your area offers coverage that would reduce those costs. During Medicare open enrollment from October 15th to December 7th, you can switch plans. And the Medicare Plan Finder at medicare.gov will show you exactly what dental, vision, and hearing benefits are included in each plan available in your zip code. The eighth thing Medicare actually covers that most people do not know about is home health services. If you are homebound and your doctor certifies that you need skilled nursing care or therapy services, Medicare covers home health care provided by a Medicare-certified home health agency. This includes skilled nursing care, physical therapy, occupational therapy, speech-language pathology services, and medical social services. Covered home health services under Medicare are provided at no cost to you, with no deductible and no copay for the services themselves. The key requirements are that you must be considered homebound, meaning that leaving home requires considerable effort, and that a doctor must certify that you need skilled care and order the home health services. Many people who would qualify for this benefit do not receive it because their doctor did not mention it, because they did not know to ask, or because they did not realize they met the homebound requirement. If you or someone you care for is recovering from surgery, managing a chronic illness that makes leaving home difficult, or needs skilled therapy services, ask your doctor specifically whether you qualify for Medicare-covered home health care. Now let me come back to Frances. When Frances finally sat down and reviewed her Medicare coverage in detail, she found that she had been leaving money on the table for years. She enrolled in her annual wellness visit. She asked her doctor about the diabetes prevention program and was referred to one. She began seeing a counselor through Medicare and stopped paying out-of-pocket rates. and when her doctor mentioned cardiac rehabilitation. After a minor cardiac event, the following year, she knew to say yes immediately, because she already understood that it was covered. Frances did not become a Medicare expert overnight. She just finally got the information she needed to ask the right questions. That is what I want for every person watching this video. You are paying for Medicare coverage. You have been paying into this system for decades. You deserve to use every benefit you are entitled to. Here is what I want you to do today. Call your doctor's office and ask about scheduling your annual wellness visit if you have not had one in the past year. Ask your doctor at your next appointment whether there are any preventive screenings you are due for that Medicare covers at no cost. If you use tobacco, ask about Medicare-covered smoking cessation counseling. If you have experienced a qualifying cardiac event, ask about cardiac rehabilitation. And if you are currently on original Medicare and paying significantly out of pocket for dental, vision, or hearing, go to medicare.gov during the next open enrollment period and compare Medicare Advantage plans in your area. The information is free. The call to your doctor is free. The annual wellness visit is free. The screenings are free. The only thing that costs you is not knowing. And now you know. Subscribe to this channel if you have not already, and share this video with someone you care about who is on Medicare. Drop a comment below and tell me which of these 8 benefits was new to you today. I read every single comment. I am Margaret. I will see you next week.